Nutrition Advisor at the Office of Maternal Child Health and Nutrition at USAID's Global Health Bureau, and we're very sorry for the technical difficulties this morning, but we have a very valuable presentation coming to you from Malawi this morning. And I'm happy to introduce to you today's webinar will be presented by Janet Gutta, a public health nutritionist currently serving as the Deputy Director for Nutrition for the Malawi Government Ministry of Health. She has a Master's in Nutrition Management from the University of Western Cape. Her role is Policy and Guidelines Development from MIYCN, CMAM, and NAC. She provides technical guidance to all stakeholders working in the health sector in Malawi. She identifies nutrition problems affecting the Malawian population and initiates programs to address the identified problems. She has over 13 years of experience working in public health nutrition. Welcome, Janet.
Welcome. I am Florence Banari, actually, presenting on behalf of Janet. Okay.
All right. Well, thank you. We look forward to the presentation.
Thank you. I'm presenting on Baby-Friendly Hospital Initiatives, Experiences from Malawi. Next slide. Historical background goes. During the 27th World Health Assembly that was held in 1974, it was noted with a lot of concern that there was a significant decline in breastfeeding due to several factors, including marketing promotions of breast milk substitutes. Next slide. These factors actually included the factors influencing the change in breastfeeding patterns in Malawi. They are as follows. Others are for, which are positive. Others are against. So I'll start with the ones that actually started the push in the positive direction. The push in the positive direction was that at the time, Malawi had better education in terms of its doctors. And there was acts and resolutions in relation to BFHI. And then there were BFHI campaigns, and also there were changes in the workplace. There was education, there was motivation and support for children's rights. These actually were for the positive changes for the breastfeeding patterns in Malawi. Whilst in the negative push or the negative direction, the health professionals were taught how to prepare formula and not how to prepare mothers for breastfeeding. The country also experienced quite a lot of media that made it very fashionable to bottle feed. Promotion of artificial feeding by manufacturers was also the fashion of the day. More working mothers also emerged on the scene, which made it more difficult for mothers to sustain breastfeeding without support from the health workers. Another slide. There was issues of a big part of the problem as well as the challenges. I've already indicated the issue of unethical marketing of breast milk substitutes, which contributed to the decline of breastfeeding practices. The fact that mothers were exposed to commercial pressure to replace breast milk either completely or partially contributed to the problem of undermining breastfeeding as a culture. Another slide. What is Baby-Friendly Hospital Initiative, by the way? The Baby-Friendly Hospital Initiative is an initiative that was introduced by UNICEF and World Health Organization to ensure that all maternities or health facilities, whether free, standing, or in a hospital, become centers of breastfeeding support. Another slide. Goals of the baby-friendly hospital initiative are at least two. The first one was to transform hospitals and maternity facilities through the implementation of the 10 steps to breastfeeding successful. The second one, to end the practice of distribution of free and low-cost supplies of breast milk substitutes to maternity wards and hospitals. Another slide. The how of doing that or achieving. A maternity facility can be designated baby-friendly when it has implemented the 10 specific steps to support successful breastfeeding and it does not accept free or low-cost breast milk substitutes, feeding bottles, or tips. Another slide. BFHI in Malawi. BFHI was adopted in Malawi in 1993. After it was launched in 1992 by UNICEF and World Health Organization in response to the declining breastfeeding rates, especially among mothers who delivered in health facilities. Another slide. Another slide. Okay, BFHI objectives in Malawi. The first objective was it is used to improve the quality of health care and support for mothers and to empower mothers to successfully breastfeed their babies exclusively for the first 6 months. The second objective is to create a continuum of care for the mothers and their babies beyond the health facility to the household and community level. Another slide. The situation at the moment. Breastfeeding is a traditional norm in Malawi, but exclusive breastfeeding for the first 6 months is a challenge, or at the time was a challenge. Most mothers and other caregivers tend to give or introduce other fluids and foods before the age of 6 months. Another slide. But things went wrong. 48 facilities were targeted out of 644 facilities providing maternity services. Out of the 644, only 26 health facilities were certified baby-friendly. The last assessments were done in 2004. They called for concern. The exclusive breastfeeding rate dropped by 10 points to 61% in the 2015-2016 DHS. Another slide. Challenges. There were many challenges of which the following are part of them. Financial challenges. We had low financial resources. There was high turnover in terms of staff over a big challenge. And there was maintenance of health workers' morale and commitment became a problem. Some mothers started antenatal late and they deliberately missed some important lessons, such as lessons for BFHI. Another slide. Fruit of BFHI in Malawi. This is the trend of exclusive breastfeeding, which actually were obtained through the initiative of BFHI. For the Malawi DHS that was done in 2000, the rate was at 45%. The MDHS that was done in 2004, the rate was at 53%. While the MDHS that was done in 2010, the rate had gone up to 71%. And then the MDHS that was done in 2016, there was a very big decline, then it ended up to be 61%. Another slide. Fruits of BFHI And this is in relation to early initiation of breastfeeding within the first hour of birth. The MDHS of 2004 had this early initiation at 69.8. MDHS of 2010 had it at 94.5. And MDHS of 2016, it shows a decline because it is at 76. Another slide. Where are we now? Since 2016, there has been a revision of the 20-hour course and an updated package according to the current World Health guidelines, with a special focus on preventing mother-to-child transmission. 1,000 clinical and non-clinical staff have so far been trained on BFHI, and over 1,400 community volunteers, which includes village chiefs, have also been oriented to BFHI. Another slide. Linkages to the community level. Training of community was based on BFHI counselors on lactation management, which included positioning and attachment, reinforcing benefits of exclusive breastfeeding, and linkages with the trained care providers of continued support. These counselors will follow up with mothers who have just been discharged to sustain exclusive breastfeeding. Our health surveillance assistants who are attached to health facilities also have been trained or oriented in breastfeeding to support community volunteers and care groups at community level. Another slide. The key strategies that have been used to achieve the 10 steps are, there has been the capacity building. And the capacity building, that's where members of staff at facility level, including their management team, have actually been trained to breastfeeding or the BFHI initiative. Followed with supervision, because the facility have to be supervised in terms of how they are implementing the initiative. And then followed by coaching and mentoring exercises. These coaching and mentoring exercises strengthen and support the health facilities in terms of trying to aspire and achieve the status of a baby-friendly facility or baby-friendly hospital. There are also routine assessments, both within the facility, which are known as safe assessments. They are done by the hospital staff themselves. And then the external assessment, by which external assessors outside the facility come to assess the practices of this particular facility. And depending on their achievement or their performance, they are either designated baby-friendly or committed to becoming baby-friendly, or they haven't done, they have missed the issue altogether. So accreditation takes place if a facility is said to be a baby-friendly facility or a facility that is committed to becoming baby-friendly. That's where accreditation takes place. Another slide. Some key results in terms of the indicator. The number of BFHI stakeholders that have been oriented so far are 140 members of district health management teams in all the districts that the project was actually implementing. There have been 60 BFHI master trainers that have been refreshed so far, and 1,080 clinical, it's gone. Okay. 1,080 clinical and non-clinical service providers have been trained on breastfeeding issues. That's the initiative itself. And 1,400 community volunteers have actually been trained on the BFHI so that they are used as a support system or linkage system at community level in BFHI. 38 hospitals so far are the ones that are lined up or have got plans for self-assessment and for as a measure of their commitment. 82% has been the proportion of women counseled on exclusive breastfeeding, as well as another 82% is the proportion of women who initiate breastfeeding within the first hour in these facilities, first hour of the day. Another slide. Best practices. When we look at policy issues or at policy level, we see that there is a commitment by Ministry of Health to spearhead the BFHI activities and provide technical assistance or technical guidance. When we look at capacity, we see that we have got master trainers, we have got DHMT members, we have got clinical and non-clinical staff, as well as community volunteers who have got knowledge in the BFHI. And for sustainability, we are looking at budgetary allocations, which is the reliable and sustainable measure, and then institutionalization, as well as taking BFHI into the routine services that are delivered as part of the continuum of care, as well as continuous assessments and annual evaluation. Thank you so much.
Great, Florence. Thank you so much for an excellent presentation. So we have some questions from people online. So I will read the questions, and if you would be able to answer them after I read them, that would be greatly appreciated. So the first question from Melon Duffy Tanamali, and she asks, what factors contributed to the increase to 71% exclusive breastfeeding in 2010 if only 26% of maternity facilities were certified BFHI?
Thank you so much for the question. In 2010, the rate went as high as 71%, despite the short number or the few number of facilities, about 26 or 27 that were baby-friendly. The issue there is that there was quite a lot of commitment at all levels, that especially at the facility level, mothers actually got all the information in relation to breastfeeding. No facility left their mother without giving them the support and the service, and then the linkage at the community level was quite good at that particular time. So the referral system, starting from the health facility down to the community level, was very, very good. So at community level, they did more of the mother counseling into the breastfeeding issue. Thank you.
Great, thank you so much. So another question from Joan Jennings on TOPS, and she said it's great to see that a focus on BFHI is going on. Are there any other concerns related to the poor status of the exclusive breastfeeding indicator?
Can you repeat the question? We missed it.
Sure, sorry. So the question again is, it is great that a focus on BFHI is going on, but are there other concerns related to the poor status of the exclusive breastfeeding indicator?
Concerns on the poor status of the breastfeeding.
Thank you for the question. Yes, there are other concerns related to breastfeeding at the moment in Malawi. I think the increase in the number of women as related to going through education, or mothers actually that are being educated through the normal the academic, and the emerging of the HIV/AIDS problem brought a bit of a confusion at that particular time. So there was like we are giving a double standard message. At that particular time, when it was eventually Malawi's turn to say, for us to go option plus, any mother with HIV, any mother without HIV, or those who are who don't know their status, everybody should go breastfeeding. There was a segment of the population that felt it wasn't right, and they decided to go what they thought they knew, either from theory, either from internet, or from whatever source that they tried to get, either from the newspaper and whatever. That was competing with the Malawi government's policy. And then the eagerness for mothers to actually trust and believe in their breast milk indeed went down. Plus the issue to do with funding, when there was the donor shift in terms of shifting their focus in terms of the BFHI as a strategy versus the nutrition at the community level. When there were no funds at the facility level, the BFHI itself actually also failed to get more support, and indeed it declined. And it went in, this brought the whole decline from the 71 to the 61, where 2016 GHS showed. Thank you.
Great, thank you so much. So the third question from Judy Kanawati, and she wanted to know, have there been changes to the pre-service medical and nursing curricula to include BFHI and more training and practice on breastfeeding so that in-service training can focus on other issues?
Thank you for the question.
Yeah, just to answer that question, this is Alberta. Yes, we also are working in collaboration with FANTA, with the FANTA project, who is currently working with the Nurses Council and the nursing institutions, and have developed the curriculum that which includes infant and young child feeding, BFHI, CMAM, and so growth monitoring and so on, which is being included into the curriculum. So very soon, this is going to be part of the academic content of the training of nurses in Malawi, starting from September 2017. Thank you.
Great, thank you so much. So the fourth question from Melon Duffy Tanamali, and she asked, please tell us more about the role of community volunteers in BFHI.
Thank you for the question. The role of the community volunteers actually is to counsel their mothers, so the mothers who are breastfeeding in the community, as well as to track down on mothers who have got babies less than 6 months old, but then they are actually deciding not to continue with breastfeeding. They have to counsel these mothers to actually look at breastfeeding as the optimum nutrition measure for this type of children. So at the community level, the chief, the village chief, is the custodian of all the culture and all the, he is or she is the in charge of all the villagers at that particular time, that particular attachment area. And he actually has the final say. So the fact that the chief was oriented, and it is the chief that is going to tell the mother to continue breastfeeding. It's something that is taken very seriously by every member of his village and household. Thank you.
Great. Thank you so much. So this question is on a specific slide, so we're going to go to that exact slide. But this is from Leslie Koo on behalf of Olberg Desenor. And he said, in the slide showing results, including 82% of women who were breastfeeding, does this mean that 82% of the women in the 38 hospitals mentioned in the same slide? So we'll just go to that slide 1 second. So this slide right here, where it says, showing results that say that 82% of women who are breastfeeding, does this mean 82% of the women in the 38 hospitals in the third line above that?
Yes, it's only the 38 hospitals. Thank you.
Thank you so much. Any last questions from anybody online? Please enter them in the chat box. Yeah. If there are no questions, I'll turn it over to Janice Alvey to close the webinar for the day. Great. Thank you so much, Florence and Alberta, for the wonderful presentation and for answering all our questions. As Julia mentioned, this concludes the USAID World Breastfeeding Week webinar series. We want to give a big thank you to the TOPS program and the Office of Food for Peace for their support for hosting many of these webinars this week, as well as a big thank you to the USAID Assist Project, the Maternal and Child Survival Program, and the Every Preemie Scale Project for the wonderful presentations we've had this week. If you were not able to join us each day, all of the presentations will be available at the FSN Network webpage next week. And before we close, I just want to take a minute to reflect on this past week in light of the World Breastfeeding Week theme, Sustaining Breastfeeding Together. I think we've learned from the various presenters this week that purposeful and multi-sectoral partnerships are essential for improving optimal breastfeeding practices. On Monday, we heard that barriers that women face to exclusive breastfeeding at different points, starting in pregnancy and throughout their postpartum. There's different interventions and partnerships that are needed throughout, whether it be with ANC providers, employers, or family and community members to improve the support for women. On Tuesday, we learned of the many challenges of breastfeeding and breastfeeding support in emergencies. And one such example of purposeful partnerships was with the media to cease the demands for infant formula donations so that non-breastfed infants could be supported appropriately and would not undermine other breastfeeding infants. On Wednesday, we learned how an approach to forming partnerships with a focus on systems to improve packages of services and quality of those services can greatly enhance a mother and infant dyad's chance of HIV-free survival in a sustainable way. And yesterday we learned how vulnerable and sick newborns and their mothers and families need specialized breastfeeding support. And while there may not be current guidelines on how to deliver that support in low-resource settings, models exist and are forthcoming from the WHO. An additional partnership that we did not cover in our webinars this week is a new initiative launched by UNICEF and WHO, the Global Breastfeeding Collective. The Collective is a partnership of over 20 prominent international agencies and NGOs who are committed to protecting, promoting, and supporting breastfeeding. I encourage you to go to their website, www.unicef.org/breastfeeding, to learn about some new research on country breastfeeding scorecards and the investment case for breastfeeding. As the Collective emphasizes, breastfeeding is not a one-woman job. We hope you've enjoyed the webinars this week and that you've learned more about how USAID and our implementing partners are supporting breastfeeding and our approaches that we're taking to sustain breastfeeding, promotion, protection, and support together. Enjoy the last few days and happy World Breastfeeding Week.